Okay, so we've got the points to support reproduction and conception. So we have the internal pelvic ligaments here, the pudendal plexus around here, the symphysis pubis and the piriformis, so if you can see the contours of the talus and the calcaneus there. Then we have some more internal ligaments, and then just above where the bones meet we've also got the, my mind's gone blank, ilioinguinal ligaments there. And then on the more lateral side of the foot, in line with that fourth zone going all the way down, we have got the psoas muscle there. So those are the points that are really good to include. Points to avoid is the spleen 6, which is about 6 thumb widths up the leg, so it's about here on the medial aspect, which you don't go up anyway. In reflexology, we've got the bladder 67, which is the big toe, little toe, where we'd normally work on the wisdom teeth. And then there's also bladder 60, which is just the back of the lateral malleolus there, back of the ankle. So again, somewhere which is quite easy to avoid in reflexology as well. We just avoid any of that underneath squeezing and work with the foot like that. So if we're supporting conception, the first treatment is just the same as what you would normally do, except for missing those points in case they would be pregnant, picking up on what their body and their feet are trying to tell us. Then the second treatment would be working on using the information we've already gained, and then also focusing on the conception areas as well. So we would observe the feet to see if there's any changes from last time, focus on relaxing and deep breathing, depending on what's appropriate for the client. Then we'd carry out a normal reflexology treatment and then go back and focus on the following, or do it vice versa. So the endocrine system, so that's working through the endocrine routine, so linking all of the points on one foot then the other, then going back and sweeping both together. And then after that we would support the reproductive system. So what you could do is work on the ovary, fallopian tube, uterus, vagina, and repeat on the other foot. If it's a man, then obviously male reproductive organs. Then we can include these additional points that we've just added in here. Go back onto any major organs such as the head, lungs, heart, liver, pancreas, possibly even kidneys as well for detoxification. And then going back to any other points that haven't already been covered, refocusing on them, carrying out more relaxing techniques, and then finish off with the brain balance, which is one, your thumb and your finger either side of the joint on the big toe, and then your index finger on the top. You do that on both feet at the same time, and you hold very gently. Excuse me. Not great timing. Without applying pressure, and then finish off with breathing techniques.